Hey there, fellow knowledge seeker. Ever feel like you need a PhD just to understand your health insurance?
Oh, tell me about it.
We are diving deep into that black hole today,
Yeah.
specifically for all you moms out there.
Right.
Because, let's face it,
Mhm.
deciphering insurance jargon while wrangling kids
Yeah.
is a special kind of torture.
Oh, it's an Olympic sport, practically.
Right.
But that's why we're here
Yeah.
to equip you with the insider knowledge to make the system work for you,
Yes.
not against you.
I love it. I'm all ears. Now,
Yeah.
our first source tackles a scenario I think we've all faced.
Right.
When your doctor prescribes something you know you need,
Right.
but your insurance throws a tantrum.
Right. The dreaded denied medication notice.
Uh,
It's enough to make anyone's blood pressure spike. But what's interesting is the power dynamic at play here.
okay.
Insurance companies want to control costs,
Yeah.
so they often default to no.
Right.
But they're not doctors, are they?
Thank goodness for small favors.
Exactly.
Yeah.
And this source highlights a brilliant tactic to leverage that.
Okay.
It's called positioning the insurance company as your doctor of record.
Okay. That sounds a little sneaky and maybe like a little intimidating.
Yeah.
How does that even work?
But you're basically calling their bluff
Okay.
when they try to override your actual doctor's prescription.
Right.
You calmly point out that they're stepping outside their lane.
Okay.
They're not licensed to practice medicine.
Right.
So by denying a medically necessary prescription,
Yeah.
they're essentially acting as your doctor. And that's a legal no-go.
So you're not actually making them your doctor, you're just highlighting the absurdity of their denial.
Exactly.
That's genius.
It reframes the conversation
Yeah.
and forces them to address the issue on medical grounds,
Right.
not just financial ones.
That makes so much sense.
Yeah.
Okay, so okay.
It's a good one.
Does this strategy work for other situations, or is it just for medications?
The beauty of this tactic is that it applies to so much more
Okay.
than just prescriptions.
Okay.
Think pre-authorization for procedures,
Right.
out-of-network providers.
Yeah.
Anytime the insurance company tries to dictate your medical care,
Uh-huh.
you can use this to remind them who is actually calling the shots.
This is pure gold. So
I know, right?
let's dive into those other situations.
Sure.
Say you need a procedure,
Okay.
and the insurance company throws that dreaded pre-authorization required roadblock your way.
Ugh, the worst.
What's the play there?
This is where a medical necessity letter
Okay.
becomes your new best friend.
Okay.
And it's not just a prescription.
Yeah.
It's a power move.
Okay.
Your doctor needs to lay out a compelling case for why this procedure is essential,
Okay.
backing it up with research guidelines.
Yeah.
Think bulletproof evidence.
So you're basically arming yourself with the big guns,
Exactly.
proving that it's not just some frivolous medical whim.
You're shifting from, I want this, to, this is medically necessary and here's why.
That's brilliant. But
Mhm.
what about those situations where you need a specialist
Yeah.
and they're out of network?
Yeah?
Those costs can be absolutely
I'll
terrifying.
tell about it.
Like what's the...
That's where the gap exception comes into play.
Okay.
A phrase worth memorizing.
Okay. Got it.
It's essentially asking your insurance to cover the out-of-network provider at in-network rates
Okay.
because there's no comparable specialist in your network.
Right.
Again, documentation from your doctor is key here.
So it's all about building that paper trail, making your case rock solid.
Exactly.
Got it.
And always ask for an itemized explanation if they deny you.
Oh, okay.
This forces them to justify their decision
Okay.
and can often reveal flaws in their reasoning.
That's a really good point.
Yeah.
Okay, this is such empowering information. It
Yeah.
feels like we're finally starting to crack the code.
I know.
Now our second source goes even deeper into some specific scenarios.
Right.
And the first one I have to ask about is pregnancy-related coverage.
Okay.
I mean, you'd think that would be a no-brainer, right?
You'd think so, wouldn't you?
Right.
But unfortunately, it's not always smooth sailing.
Really?
The source highlights how coverage for things like certain prenatal tests,
Mm-hmm.
postpartum care, even lactation support
Wow.
can be surprisingly limited.
I had no idea.
And this is where knowing your specific policy and state mandates is crucial.
So it's not just about knowing the system in general, but also becoming a detective with your own plan.
Exactly. Knowledge is power.
Okay.
And in this case, it's about being proactive.
Right.
For example, did you know there's a benefit called EPSDT?
EPSDT.
EPSDT.
I can't say I'm familiar with that one.
Okay.
Fill me in.
Think of it like a VIP pass for kids' healthcare. It ensures those children receive any medically necessary services,
Okay.
even if those services aren't typically covered by standard Medicaid.
Wow. So even if it's something that's not usually covered, this EPSDT benefit could come into play.
It's precisely.
Wow.
It's a powerful tool that many parents sadly aren't aware of.
Okay, my mind is officially blown.
Yeah.
So we're talking things like therapy specialist visits, that sort of thing,
Uh-huh.
all potentially covered under this EPSDT.
You got it.
This is invaluable.
It can be a game changer for families struggling to access the care their children need.
Absolutely. But let's talk about mom's mental health.
Okay.
Because let's be real, wrangling kids and navigating this healthcare maze
Oh, yeah.
is enough to send anyone into therapy.
Right.
What kind of coverage can moms expect for their own mental well-being?
You're preaching to the choir here.
Yeah.
Mental health is just as critical as physical health.
Yeah.
But unfortunately, it's not always treated that way by insurance companies.
Right.
The good news is
Right.
there's a federal law called the Mental Health Parity and Addiction Equity Act.
I've heard that term thrown around, but to be honest, it sounds a bit like legal jargon to me.
Okay, sure.
What does it actually mean
Yeah.
for someone sitting at home trying to figure out if they can afford therapy?
Imagine this.
Okay.
Your insurance covers unlimited visits for a broken leg. Right? The Parity Act basically says
Okay.
that they should be offering comparable coverage for mental health therapy sessions.
Okay.
It requires insurers to provide mental health coverage that's on par with their physical health coverage.
So it levels the playing field, at least in theory.
In theory.
But what happens when you need a specialist who's out of network
Right.
and there just aren't any good options within your network?
Yeah.
I feel like that's a common problem with mental health providers.
Absolutely. And both our sources address this head on.
Okay.
They emphasize the importance of being upfront with your insurance company.
Okay.
Explain that there are no suitable in-network providers for your needs.
Okay.
And be prepared to push for an exception.
Right.
Highlight why this specific out-of-network provider is crucial to your care
Okay.
and what the impact would be if you couldn't see them.
Right.
Again, having your doctor back you up with documentation can make all the difference.
It's like we're building a case file here,
Yes.
presenting our argument to the insurance jury.
You got it.
Yeah.
You're advocating for your health. And sometimes that means pushing back against the system.
For sure.
Persistence is key.
Persistence. I love that.
Yeah.
So empowering. Okay.
What is?
We've covered a lot.
We have.
But I can't let you go without talking about fertility treatments.
Okay.
They can be so incredibly expensive.
Oh, yeah.
And coverage always seems so murky.
Right.
What do moms need to know about navigating that maze?
You're right. Fertility treatment coverage is a whole other beast.
It really is.
One of the most important things, according to our sources,
Mm-hmm.
is to understand your state laws.
Okay.
Believe it or not,
Okay. Yeah.
some states actually mandate that insurers cover fertility treatments,
Really?
at least to a certain extent.
I had no idea.
Yeah.
So that's something every mom should check out because it could give them some leverage depending on where they live.
Exactly. It's not a guaranteed win,
Right.
but it's a crucial starting point.
Okay.
The sources also point out that even if your primary health insurance doesn't cover those treatments,
Yeah.
you might have other options.
Okay.
For example, some employers offer supplemental plans that specifically address fertility benefits.
It's good to know. Every little bit helps when you're dealing with those kinds of costs.
Absolutely.
Right.
And while we're talking about those hidden costs, our sources also mention those unexpected expenses that could pop up at the doctor's office,
Oh, gosh, yes.
like fluoride treatments or certain vaccines that might not be fully covered.
Oh, don't even get me started. Just last week, my dentist was recommending all these extras for my son. And I was trying to calculate in my head what our insurance would actually pay for.
Yeah.
Let's just say my mental math skills were failing me,
Right.
and the stress level was real.
It's a classic scenario
Oh, my God.
so many parents face.
Yes.
One helpful tip from the sources is to ask about cash pricing.
Okay.
Sometimes providers will offer a discount if you're paying out of pocket.
You know, I never would thought to ask that, but it's brilliant.
Right.
Yeah.
It never hurts to ask.
That's true.
And here's another power move.
Okay.
If the insurance company denies coverage for something your doctor deems medically necessary,
Yeah.
ask your doctor to write a detailed explanation of why it's needed.
Okay.
You can use that documentation when you appeal the insurance company's decision.
It's all about building that paper trail.
Yes.
Creating a strong case for yourself. This has been incredibly eye-opening.
Yeah.
So as we near the end of our deep dive,
Yeah.
is there one big takeaway you want our listeners to walk away with today?
You know, It's easy to feel overwhelmed by the world of health insurance.
Oh, yeah.
It feels like you're constantly fighting an uphill battle.
Right.
But the real takeaway here is empowerment.
Okay.
Knowledge is your secret weapon.
Gotcha.
Once you understand your rights and are willing to ask questions,
Yeah.
to push back respectfully but firmly,
Right.
you can level the playing field.
I love that don't take no for an answer.
Yeah,
Become an advocate for your family's health.
absolutely. And remember,
Yeah.
no one knows your family's needs better than you.
That's so true.
You're their best advocate.
This has been so insightful. Thank you so much for demystifying this complex world for us.
My pleasure. It's all about working the system smarter, not harder, right?
I love that analogy.
Yeah.
And sometimes, as we've learned today,
Yeah.
it's about knowing the right words to say.
Yeah.
Doctor of record. Gap exception.
Exactly.
Who knew those magic phrases even existed?
Right. It can feel intimidating, but when you break it down,
Yeah.
it's about understanding those key strategies and having the confidence to advocate for yourself and your family.
And having amazing resources like the ones we've discussed today. I know I'll be bookmarking these tips for future reference.
I applaud that.
Yeah.
Knowledge is power, after all.
For sure. And for our listeners,
Yeah.
if you're feeling inspired to take charge of your family's health insurance, I have a final thought for you to chew on.
Oh.
Today we focused on challenging denials,
Right.
fighting those battles after they happen.
Yeah.
But what if we flip the script?
Okay.
How could you use this knowledge proactively?
Right.
Imagine researching your plan in depth before making healthcare decisions.
Yeah.
Or having those sometimes tough conversations with your doctor up front about costs and coverage.
Right.
It's a whole different way of thinking about health insurance, and it might just save you a whole lot of headache down the road.
Absolutely. Being proactive can make all the difference.
Couldn't agree more.
Right.
Until next time, fellow knowledge seekers, keep asking those questions and never stop advocating for yourselves and your loved ones.